Well, sexual dysfunction is a subject that most women don't want to talk about. Dr. Dionne Oliver, OBGYN from LifeBridge Health, is here to tell us more. Welcome, Dr. Oliver.
Hi, how are you?
I'm good, thank you.
Good.
You know what? I think every time I turn on the TV, there's a commercial that's helping men out, but not much is being said out there for women.
Absolutely. Sexual dysfunction is very prevalent in women. It affects 40% of women. 40% of women say they have a sexual problem, and 12% of women say they have a severe sexual problem, but they don't often go to their doctors and talk about it. Only 6% of women actually seek help for this problem, and physicians only ask questions about sexual dysfunction 18% of the time. So in most instances, when women go to a doctor for their yearly well-woman exam or they go to their general practitioner, the question of sexual dysfunction or sexual health is not even discussed.
Okay, and so is this a particular age group that's affected mostly?
It affects most age groups that are sexually active, and there are various causes, and there are reasons that are more prevalent in different age groups. But sexual function has a lot to do with the childhood experiences. It has to do with the interpersonal relationship. Some of it can be due to physical problems. So when we talk about sexual function, we talk about the stages of sexual function, which include 4 stages. There's desire, which is the sensation or desire to have sex, and then there's arousal, which accompanies desire and has to do with hormonal changes that in men cause an erection and in women causes vasocongestion of the vaginal organs, including the clitoris. And then there is orgasm, and followed by resolution. So each one of those phases can be affected individually, or there can be affected totally and causing sexual dysfunction. So finding out what the problem is key.
So it's key. It starts in the doctor's visit, asking the right questions.
And you have to be comfortable with your patient. The doctor has to be comfortable asking those questions, because if the doctor seems uncomfortable, the patient is less likely to elicit the information the doctor needs to make a diagnosis.
Is that the right person to talk to it about?
In some instances it is. It depends on what the problem is. Some of it is due to interpersonal conflict in the relationship, so sometimes talking to a counselor, a marital counselor. Some of it can be physical or due to symptoms such as endometriosis or fibroids. It can be due to involuntary spasm of the vaginal tissue, which is called vaginismus. It can be due to pain issues. And in menopause, women have lack of estrogen, which can cause vaginal dryness or atrophy of the vaginal tissue. Mainly, there are issues related to desire in younger women, and sometimes there are issues related to medications. So certain medications can cause sexual dysfunction. So taking a thorough history is very important, because you have to get a history of any surgeries the patient has had, a history of the medications they're taking, a history of their childhood experiences, and whether or not they've had any sexual molestation or any problems in adulthood as far as physical or sexual abuse is concerned. And then you have to really sit down and talk to your patients about their current interpersonal relationship and how they feel about their partner. Self-esteem issues play a role in it, how you feel about yourself, your self-image. Those things are very important. So it's important to ask the right questions, and it's also important to listen to your patients. Many times you can key in on some problems if you just listen, and then you can ask the right questions to guide the patient to the diagnosis.
Giving birth, is that in pregnancy, you know, after that, there's always some, is that a time when women experience problems?
Well, you know, your sexual health has a lot to do with your mental health. And the other thing we don't talk about is sometimes women are depressed during their pregnancies, so we need to address those issues as well. As far as the physical aspect of being pregnant, there are a lot of hormonal changes that occur. There are changes in estrogen, progesterone levels. Prolactin, which is the hormone that actually elicits breastfeeding, those increased levels can actually decrease sexual desire. So some women, especially in the immediate peripartum period, will complain of decreased sexual desire. Also, self-image has a lot to do with how you feel. A lot of women don't feel sexy when they're pregnant for whatever reason. So, and then the personal relationship between the partner and that person changes, especially after you have children. Fatigue can be the cause. If you're dealing with, you know, being up in the middle of the night and you want to just sleep during the day. So a lot of these things play an issue in sexual dysfunction.
When do you talk to your doctor about it?
I think it's important for, if you feel that there is an issue, I think it's important to feel comfortable enough to talk to your doctor. But more importantly, as a physician, I think it's important that we sit down and as a part of our examination, we ask those questions, because a lot of times patients will not bring that information to you. You have to ask them, and if you ask them in a kind and confident way and you're not embarrassed to bring up the subject, they will often tell you what's going on.
Okay. We have about 2 minutes left. I want you to tell me a little bit about how you became a doctor.
Well, I was raised by two very young parents. My mother was 20 when I was born, and my father was 17. They got married, and my father was in the Army. He was a tech, and he, worked in a hospital. But I've always been curious about science. I was one of those children, when I was outside, I was dissecting insects. And so in school, science was a subject that I was very curious about. And I'm a very personal person, so I like talking to people. People think that women's health or doing obstetrics and gynecology is limited because you're working with just women. But you get to build relationships with your patients. I see them every year for their well woman. The happiest event in medicine is having a baby. I get to share that experience with them, and we get to do surgery as well. I'm in a hospital setting. I'm in a clinic setting, and so it's really very broad, and I love what I do. I love interacting with my patients. They're like an extension of my family.
And Dr. Watkins Johnson was saying, people say, oh, it takes years to become a doctor. Don't listen to them, follow your heart. And your advice to young people?
I think that you should always do well in school. Don't take your education for granted. You get to have an education, you get to sit and learn, and you get to develop those skills that are going to enable you to go to college and do well in life. And I think sometimes children think that school is just about the socialization. It's about learning the craft and skills you need to get to college and to do the things that will give you a better opportunity for doing anything you want to do in life to succeed.
And seek out the people who are doing what you're doing.
Absolutely.
I'm sure if some young person called you up and said, I'd like to shadow you for a day.
Oh, I love it. I love it. Absolutely.
All right, they can find you over at Life Forge Health.
They can.
All right, thank you so much for coming in.
Thank you so much.
Lots of good